It's not always about popping bones. It's not
Mhm.
always snap, crackle, pop. A lot of us do soft tissue work as well. And so for those kind of instances, we would start addressing what is going on with the soft tissue around it. Are there areas that we can strengthen? Are there trigger points that we can release? Is there scar tissue that we could break up? What Not every chiro does soft tissue work. So that's one of those things where you kind of have to do that interview with a
Mhm.
chiropractor and ask them, hey, do you do soft tissue work? I love it, and I do it with most of my patients because they need it. But not everyone does that. So I don't want to say that that's a norm across the field, but more often than not, you will see that either in some form of cupping or Graston or trigger
Mhm.
point therapy. So it could